Welcome to the Rebekah Panepinto project. Today, I am very excited to host a new friend named Mark Zawodny. Mark serves as the Chief Information Officer at CareAdvantage. There, he leads enterprise IT strategy, infrastructure modernization, and digital transformation initiatives across the organization's footprint, with a focus on improving operational efficiency, data security, and client care through technology. Mark oversees all aspects of the IT systems, cybersecurity, and data architecture. He plays a key role in aligning technology investments with strategic business goals while driving innovation and enabling scalable growth. Mark brings over 2 decades of experience within healthcare and enterprise technology, having also founded a healthcare-focused software firm and having held operational leadership roles across the technology sector. He holds an MBA and a bachelor's degree from the University of Maryland and is a hands-on and visionary leader. As you'll see in today's episode, Mark is very passionate about leveraging technology to streamline care delivery, support care providers, and improve outcomes across complex healthcare environments. Enjoy the show. Mark, welcome to the show today.
Thanks for having me.
Very excited. Got introduced to you by a very dear mutual friend who's actually been on the show twice now. So excited to expand the horizons through that relationship to meet you and learn more about your business. And we'll talk all about CareAdvantage today on the show. So I want to start with the topic heavily discussed on my show, to be completely honest, AI. Like, we've all worn it out, yes. But haven't talked a lot about it in regulated industries or healthcare specifically, who is unfortunately not known for the most innovative industry of them all. But day in and day out, it's a real impact into your business and something that you're having to adopt and implement and really understand how you drive value by leveraging AI across your business. So let's start there with CareAdvantage and the business changes that you're making that are heavily impacted by artificial intelligence.
In healthcare, certainly we're a little behind the curve when it comes to technology adoption, but we're catching up very quickly, and AI is helping to propel that for sure. It's interesting how quickly AI has become a juggernaut, these targeted platforms that have appeared relatively overnight when you really think about it in terms of software development and how long it usually takes to solve problems. That AI is really accelerating what used to be years and years of development into a very short period of time. So for a lot of different challenges, both on the administrative side, on workflow enhancement, productivity, there's a lot of different tools that are out there in the healthcare space, kind of custom built, bespoke products that are out there that are helping to solve challenges for us. Because AI has become so democratized and so ubiquitous, it's almost a kind of a challenge of, all right, where do we start? What challenges do we solve first? At CareAdvantage, we kind of started slow. We wanted to make sure that people understood what AI can do and what it can't do and kind of how it works. So low-hanging fruit for us was ensuring that people had the co-pilots of the world, the ChatGPTs of the world, the different products that are just helping general workflow, general things. AI note takers were another piece of low-hanging fruit. But what that did was kind of unlock people's imagination into what AI can do for you, and get people starting to trust AI as well. Of course, the journey of AI over the last couple of years, being accurate, coming up with hallucinations, not doing what it's instructed. So kind of bring people along and what is AI today and how does it actually help and how accurate it is and what it can do. It starts getting people a taste, especially on the leadership side. So that was intentional for us to try and make sure that we're starting small, getting people on board, and then starting to look at, all right, where are the opportunities and who has the most mature technology to be able to help us with those particular opportunities? What problems are we trying to solve? I think one thing that we've seen in the AI world is there's a lot of different products that are out there that are trying to solve all the world's problems, but they're not all ready for prime time. So making sure that we truly understand what are our biggest challenges, where are our biggest opportunities, and where are some of those products in their maturity cycle? Are they ready? Some of them deal with more conversational AI, natural language processing that's been around for a little bit. So they might be a little bit further along than agentic AI, which is, maybe more custom built and needs a lot more labor and resources to kind of get off the ground. So we started to look at some of those. We piloted a few of these products, and we're excited about the results, to be honest.
When you talk about the use cases right up into the point of agentic, essentially, I'm curious your take on debate, maybe buy versus build in that scenario, because there still is some immaturity in LLMs in general. Are you seeing, especially in healthcare, that there's some people that have baked a AI solution that is ready to go, SaaS off the shelf, that can really be a game changer to specific use cases? Or is it better to sit here and build something custom, knowing your customer better than any other partner probably knows your customer, so that you can make sure you really get the output and the overall success of the use case that you want, and not have to be like, oh, Salesforce like comes to mind. Like, you can customize Salesforce still forever, but it's still Salesforce. And so you're spending a ton of money just to customize something that like just didn't work versus just build something. So I'm curious your take on that buy versus build when it comes to solving your client's problems.
Again, I think it goes into the specific problem we're trying to solve for and how complex it is, whether we fit into the mold of something that is off the shelf and ready to go, or is it something that we just have too complex of a workflow, or maybe there's other things that, are external to what might exist off the shelf that we're just not ready for. So I want to give you two examples. We just piloted a couple different companies that are doing screening for candidates. So we hire about 200 caregivers per week across our footprint. And going up the funnel, we're getting thousands of applications that we have to look at and process. And with the we call them talent acquisition specialists, with that labor pool, they only handle about 20% of those applications. We don't even touch 80% of the applications that come in the door. We just don't have the time to do it. We're doing all this manual. We're trying to get in touch with these people. We're, trading back and forth phone calls. It's just not a very efficient process. So this is, again, where AI can help us potentially, right? We've tried other ways, doing the testing and sending out links. Our population of people that are applying for these jobs aren't very tech savvy. These are caregivers in the home. They know how to take care of a person, but they may not, test well, or they may not even have a smartphone or a laptop. So we just have to be kind of meet the end client where they are. And for us, having technology that could call a person almost immediately after they've applied, have a conversation, have that AI actually have that conversation, ingest their resume, ingest our job description, our requirements, what we're looking for, and review this as it's having a conversation with an applicant and getting data back, getting a transcript back, scoring that, analyzing it. Again, for that one use case, it's pretty straightforward. It's not too complex, and it's using relatively mature technology. And the couple of companies that we evaluated were pretty impressive. They provided really good results, and we were able to take that 20% engagement with applicants up to about 55%. And that's really just out of the box. We didn't do anything else. We didn't try and marry that with any other, engagement strategy. Like, let's try and hammer these people with a drip campaign or remind them, or it was, just kind of out of the box. Let's try this and see how it does, and really focus more on the data side. So for that simple use case, and I know there are some complexities there. This is complex technology, but there wasn't a lot that we needed to do to modify our workflow. We could drop it right in, and it was very simple, off the shelf, made total sense for us. Versus another use case that we're looking at, and we just have not found the right solution just yet, is matching a caregiver with a client. So caregivers, they're in certain geographies, they have certain transportation challenges or needs. They have certain skills, and they also have certain preferences. Maybe they can't go into a home that has a dog because they're allergic, for instance, right? So trying to match all of those skills and opportunities with the client themselves. They have a schedule. They have, I want somebody here in my home between 8 and 12, and they have their needs, and trying to match those together, while doing so kind of dynamically. The schedule kind of constantly shifts around. It's a pretty complex type of equation here. There's other complexities that I don't need to get into, but it's not as simple as just, oh, well, you could just match these two things together. There's a lot of different tentacles to this. And we just have not found anything that we can just plug into that problem and it's solved. So that's where it becomes, maybe a build versus a buy. It's too complex of something that's off the shelf. We have no way of simplifying it to fit into something that we've been able to find that's off the shelf. So, building something that might be able to look at certain portions of that workflow and start to agentically solve for those problems. So I think it depends on the problem that you're trying to solve for.
I see the future of a LinkedIn for caregivers.
That's right.
Having profiles and matching them.
That's right.
It could be coming.
That's right.
Now, I put you in the age tech space because you're heavily supporting an aging generation. But the more you talk about your caregivers, they're probably even more your customer. And I think about that group as potentially a high turnover, hard to recruit group because so many people need good caregivers. And then certain people who have more means can spend more money on things like that. Other people get kind of, what's left. So when it comes to serving the caregiver, I'm curious your take and how Care Advantage has really made sure that you're getting top-notch people, that they're happy, that they stay, and that they're really able to make an impact to this aging generation.
Yeah, I mean, on the caregiver side, certainly retention is a challenge. So keeping people engaged, the way that our business operates, we offer shifts and you can take them or you could leave them. It's not a predefined schedule like you would get at a Home Depot or Amazon if you took that job. For some of our caregivers, this is a second job or even a second career. They're retired, but still able to serve and help people. So they may have moved on from their main career, and this is a second career for them. So a completely diverse background of folks. It's difficult to support kind of broadly when you have pockets of folks that they are still on flip phones. They don't have smartphones. It's not part of their everyday. They would take a bus to work. They don't have transportation. So it's making sure that we're engaged and constantly communicating with caregivers through a variety of means is going to be key to that retention. Of course, we do a lot of the technology today with having a portal for them to go into and update their availability and accept shifts and things like that. So we do have technology solutions that are available. We also have an IVR. So for those folks that have a flip phone, you can dial in and hear those available opportunities and accept shifts, and you can clock in and clock out through a phone system. It may not be as user-friendly as an app, but for that population, it works for them. What we try and do is just, again, meet that customer where they are and try and provide technology solutions so that we can still scale, but understand kind of where they're at in their technology journey.
And where you focus mostly is these caregivers, they're entering the home. It's in-home care service for the aging population. So some notes here, personal care is covered, household help, companion care, nutrition and wellness, movement and mobility as well. As you're the forefront of seeing the needs of this aging population, and I'm sure getting a ton of feedback from caregivers, where do you see opportunity for an increase in better home health care to help people live longer and be able to stay at home even longer and not have to go finish life in a hospital?
This is a really important conversation we're having now, especially as, a lot of our reimbursement comes from Medicaid. And of course, the challenges in Washington are, they're fluid and certainly we don't know what the impact is going to be to these clients that, certainly are going to be impacted in some way, shape or form. But we're trying to have that conversation now. And we're trying to showcase the value that we provide in being a frontline, having frontline staff in the home. So if we can replace an emergency room visit or an inpatient admission because somebody fell or, that's where they go because they don't have that in-home care to know how to respond to a certain fit. They just call 911 because that's the only solution that they have. But if we had care in the home at a much lower rate, we're driving down the overall cost of healthcare. That's our argument. That's our value proposition, is by having that care in home, we are saving further down the line the more expensive ED visits, inpatient admissions, skilled nursing facility admissions. If we can get ahead of this and make sure that we are providing the appropriate amount of visits and care within the home, we're saving on that later. So we're actually having those conversations right now with the payers. So Medicaid MCOs, with private payers as well, like anybody that is willing to listen to our value proposition. But we're trying to show the data that, and this is another great exercise that we're going through right now, is pulling in all of this admission data, all of, who's been to the emergency room in the last 12 months and how often. And you can see a direct correlation between the amount of time that we're able to be in the home and of, clear reduction in emergency room and inpatient admissions. So the more that we can put a lower cost caregiver in the home and keep them at home, it's clearly driving down the overall cost of healthcare. So, it's refocusing and showing the data that this actually has a real impact. It's not just a convenience or a nice to have or a social exercise for the aging population. This has real value.
Well, and the quality of life that they get from getting to stay in their home, the relief to the family. I mean, that's huge. Like, I think anybody would prefer to, go home to visit grandma in her house or their childhood home versus running them back and forth to the ER or going into some sterile nursing home environment. It's just overall a quality of life equation, which is something that's priceless and really hard to put a number on, but the truth is it's there. I'm curious now to shift gears a little bit just to your career as a whole being so heavily healthcare oriented. What has been the draw and passion around that to really have you want to continue to make a change in such a sometimes difficult industry to be a change maker?
Healthcare was fascinating from day one. I mean, I've always, technology from very young years. I mean, since I had my first computer when I was 7, and that was a stretch for my parents for sure. I've fallen in love with technology. So it was always obvious that I was going to do something in technology. And started out in the private sector, kind of rode the .com bubble, worked in the government for a little bit, being in the DC area, but, really didn't look at healthcare, too seriously early in my career. But being in the Baltimore, DC area, there's a lot of healthcare companies based here, Hopkins famously, of course. And just, it started to be, I had a lot of friends in healthcare, nurses. My family, of course, is made up of several nurses. My grandmother was a nurse for 45 years. So healthcare was kind of in my blood, but never was a focus for me until an opportunity came up, and it just kind of clicked for me that I've had this kind of inside burning desire to make sure that I make an impact and help people. But, doing so through the lens of technology, it was never understood how I could do that. So, working in healthcare IT very early in my career, and getting that opportunity was like, okay, this is how I do it. And it's not direct, it's indirect. You're supporting the doctors, the nurses, the frontline staff, the medical assistants, everybody that's involved in actually taking care of a patient. You're enabling them to do that in the most effective way possible. And that just clicked for me. That was like, okay, that's where I want to go. That's how I can use my, for lack of a better term, gifts, my ability to drive technology and innovation. This is something that I could bring to healthcare, and it's a need. Healthcare, as I mentioned earlier, they're a little bit behind the curve, and kind of in some ways we're forced to get into technology. We passed laws to bring on EHRs. Other than that, we'd still be on paper records, I'm sure, unless if there was a financial incentive to do something, we might have still been stuck in the same way that we've always delivered healthcare. So it's always been behind the curve a little bit. So it was a clear opportunity that innovation was right for this space. We can really make an impact. Now, it hasn't always come as easy. You have to balance it against, what technology is out there, where you can make that level of impact, budgets, of course, risk tolerance. But, there was just a clear opportunity here that healthcare needed more technology innovation. And I'm glad that we're seeing a lot of healthcare companies kind of start to adopt a more rigorous and really riding this AI train as well, a more rigorous IT roadmap and really using technology as an enabler to drive value rather than the have to have. I think for a period of time, especially in the 2000s, as EHR started to come online and there was almost a force, well, it was forced on them essentially. If you wanted Medicare reimbursement, it kind of came with EHRs. So I think for a period of time, it was almost looked at a little bit adversarially. But now it's now looked at more as a value driver and enabler of value.
We need more healthcare CIOs like you, Mark. I love it. That's so cool.
Well, they got to work on cloning, right?
I'm sure it's coming.
That's right.
But I think you said it was your grandmother who was a nurse for 45 years?
Yes.
I think that's a real tangible, you can't miss the understanding of a caregiver when you've seen somebody close to you build a life around that career. So
100%. Absolutely.
Well, I want to switch gears to a very fun topic too that bizarrely is becoming a theme on my show too, which is scuba diving. Who'd ever thought as I started talking about scuba diving more, like so many people are scuba divers, but here we are. You've done a lot in your time. So tell us a little bit about that hobby for you. And I'm curious if there's some things you've learned about business through the hobby, because I mean, everything kind of comes around and kind of ties together eventually that I'm sure you've had some learnings along the way.
Yeah, scuba diving has been an interesting journey for me. I was never really that much into aquatics. I mean, I, of course, would go to the pool, but I was more of a sinker, not a swimmer, is what I say. Never really got into swimming as a sport. However, my wife is a collegiate swimmer and comes from a family of divers. Her dad was a dive master and is a dive master, And it was kind of a requirement almost if you want to be a part of the family, you dive. It really never was a goal of mine, never a bucket list item that I wanted to check off, but certainly the things you do for love. So kind of going on that first dive trip with my then girlfriend was, it made me kind of nervous. Again, I'm a sinker, I'm going down, but it's not that big of a challenge for me. I was comfortable doing it. It wasn't scary to me. So yeah, sure. What the heck? Fell in love first dive. That experience, seeing, doing those checkout dives in Bonaire, I'll remember it vividly. Like it was love at first sight. Could not believe my eyes. Just opened a whole new world to me, and I've loved it ever since. And we've been on several trips. We try and do one a year. We're actually going in a few weeks back to Roatan again, one of our favorite places. So I'm really excited about that. It's a time to kind of get away, get your thoughts. You're kind of just with you and your wife, but there's nothing around but just the scenery. So it's very cathartic in a very meaningful way. So it's just, like I said, impactful from day one. But kind of to your second point, like how I tie that into what I do in business and how I kind of integrate it into my work life. There's a couple of concepts in diving that I think tie very nicely into healthcare IT and business in general. So, one of the things you have to do is maintain buoyancy in diving. And that's essentially just finding the right balance. So you're not sinking too fast. You're not rising to the surface. You're adjusting your air so that you're staying at the right level. We do this in business or in IT. We're trying to adjust our air. We're adjusting budget. We're adjusting our risk tolerance. We're adjusting the projects that we're doing to bring innovation. That's adding or taking away air that, kind of keeps that balance, keeps it maintaining that equilibrium. We don't want to take on too much. And if we do, that just sinks us. So we've got to make sure that the budget is well balanced and understood, that we understand the risk and that folks understand all the different things that go into some of the decisions that we make and some of the projects that we want to do. And that just helps maintain that equilibrium. The other concept I was thinking of too was, of course, you always dive with a buddy. That buddy system's really key. Never dive solo, right? So I look at that kind of two ways almost. I kind of equated it in two ways. One, we have such good partnership with our clinical and our operations teams and making sure that we trust each other. We act as dive buddies. We're acting as each other's check and balance there and making sure that we're going on this adventure together. And the other way I was also looking at dive buddies was that's essentially your redundancy, your safeguard. If you run out of air, you've got that BC right next to you that you can grab that emergency air. Like that's what we do all the time in IT, right? Is making sure that there are redundancies and safeguards. You're not going to deploy a system in isolation. You're always going to have those checks, go through change control, put up those safeguards in place, in some cases redundancies in place and backups and things that you need to have to make sure that you're diving safely, you're deploying systems safely in the same light. So I think a lot of the things that I've done in diving just translate very directly into the things that I do every day in healthcare IT leadership.
Well, very cool. I have just now one final question for you, Mark, and it's around principles. What is the guiding principle that you have lived by to be successful in business?
I look at kind of clarity and consistency as my two guiding principles. There's always pressures to move fast and innovate very quickly. Certainly with AI, there's a lot of our executive team kind of tapping us on the shoulder about this new flashy thing. AI is not a magic wand. We've got to make sure that we're prepared for these things. So I think real success comes from being intentional. Helping partner with these with my executive team or others in the organization, and let's go back, understand the why, understand the problem that we're trying to solve, really evaluate the impact that it's going to have, and making sure throughout that entire process that we're doing an implementation, we're providing just consistent leadership and communication. It just helps everyone kind of get aligned faster. It builds that trust as well. I think clarity and consistency kind of naturally flow into that trust factor. If you do what you say and say what you do, that helps tremendously make sure that IT is perceived as a really trusted partner in your organization. And so I think it all just goes back to clarity and consistency. I think that's what's guided me throughout my career.
Mark, you're awesome. Great leader. Like I said, we need more CIOs like you in healthcare. So excited to keep tabs on all you're doing for Care Advantage and the impact that you're going to make for the aging community in the world. So thanks, Mark. We'll keep tabs on you and have a great one.
Thanks for having me, Rebekah. Really appreciated it.